South African Medical Association, saying now it's also concerned about the impact of the strike on their sector. The strike, which started last week, has led to staff within the health sector being unable to get to work. Surgeries have also had to be postponed, while facilities have been forced to run at limited capacity. Let's unpack this leg of the story for you. Bring in Shama's chairperson, Dr. Mvuyisi Mzukwa, who joins us now for his thoughts and considerations. Great to have you on the program as always, sir. Thanks very much indeed for making time. In some instances, we heard of medical personnel coming under attack late last week into the weekend. What are some of your major concerns as we approach what looks like a full week of the strike?
Good morning to you and to your viewers, Ayanda. We are very anxious as the South African Medical Association regarding what is happening in Cape Town. And like you correctly put it in your introduction, the anxiety comes, regarding the access, to facilities, healthcare facilities in that province. For example, if you look at what is happening now, you have poor access because healthcare professionals cannot, healthcare workers in general cannot access facilities, those that are using public transport, even those that are having their own transport, because, there's jamming of roads and all these things that are happening there. But the greatest impact is also on the patients themselves, because those who are needing urgent medical attention with emergencies, they cannot access that, and there's no staff as well in those trauma services and emergency services. But on top of that, you've got ambulances which cannot access the hospitals, and the assault of healthcare workers. So I think that is what is really making us very anxious about that situation in Cape Town.
Yeah. Do you have any kind of consolidated report or information which points out perhaps where the hotspots are so that you can advise some of your patients about how to respond to the strike?
At the moment, we've been told, for example, that, at Grootersdorp and Tygerberg, Red Cross hospitals, there's been they've stopped all those elective surgeries, because they obviously they cannot operate. But I've heard also that there are other hospitals that are facing a similar challenge in the city, which we think people should be careful, if they're traveling around those areas. And we are obviously aware of the fact that some of our healthcare workers have been assaulted, and I do think that wherever you are, it is incumbent upon all of us to be very careful. And also we call upon Santaco and all those that are involved there to say, let us prioritize communities. I mean, really. We've seen a similar occurrence, Ayanda, when we noted the strike by Nehao, where you find that hospitals' entrances were blocked and, people were assaulted, healthcare workers were assaulted. I don't understand. Even in a war zone, there's an understanding that healthcare workers are simply assisting those that are involved in injuries or having urgent medical attention that they need at that time. So we appeal, to all of those people that please prioritize communities, prioritize healthcare workers, protect health facilities in that area.
Yeah, there are rules during war, let alone during a strike. But what's difficult, of course, is that medical personnel have come under attack in the past. There's a history of that, even in places like the Western Cape. What further complicates the situation right now is that we know opportunistic criminality takes advantage of the chaos, and in some instances, it's medical personnel who are part of the casualties.
It's very true. I mean, we got reports like, for example, in the areas like Karl Bremer Hospital, Tygerberg hospitals, that people cannot cannot access hospitals, and intimidation of healthcare workers, some being assaulted, makes it very extremely difficult for people to use the services they need. I mean, health and emergencies. You cannot stop people from getting that. I mean, we need to be very, very considerate in this case. All stakeholders that are involved in this, I think they need to find a way to allow ambulances, allow healthcare workers, allow communities who are going to healthcare facilities to use those facilities. It's a matter of life and death. I think that you need to be very considerate.
Dr. Mvuyisi Mzukwa, thanks as always for helping us, or for speaking to us and helping us understand the toll this is taking on the health sector. Really do appreciate it. Dr. Mzukwa is, of course, the chairperson of the South African Medical Association.